COVID-19, we knew that some parts of the transportation sector would be affected more than others. However, these measures were necessary to protect our citizens. We've made encouraging progress. However, we have not yet won the battle.
I am announcing updated measures for cruise ships and passenger vessels in Canadian waters. Cruise ships with overnight accommodation and a capacity of more than 100 persons, that includes passengers and crew, will be prohibited from operating in Canadian waters until at least October the 31st. And passenger vessels with a capacity to carry more than 12 passengers will continue to be prohibited from entering Arctic coastal waters until at least October 31st. And that also includes Nunatsiavut, Nunavik, and the Labrador coast. For all other passenger vessels, that's cruise vessels with overnight capacity for less than 100 passengers and crew, as well as day cruise vessels, as of July the 1st, it will be provincial, territorial, local, and regional health authority requirements that will determine the timelines and conditions for resuming operations. This also includes passenger vessels operating in rivers and lakes in the Yukon, the Northwest Territories, and Nunavut. Ferries, water taxis, and other essential passenger vessels can continue to operate with mitigation measures as they do currently, such as reduced passenger capacity or implementing other alternative practices to reduce the spread of COVID-19. It's important to respect Public Health Agency of Canada recommendations and the recommendations of local public health authorities. La propagation de la COVID-19 a été variable d'une région.
The spread of COVID-19 has varied from one region of the country to the other. We need to take into account the fact that the situation is unique in every province and territory. The Government of Canada continues to monitor the pandemic and its effects throughout the entire country and the world, and is monitoring the consequences for the maritime sector.
Transportation workers safe continues to be my top priority during the COVID-19 pandemic. And the Government of Canada continues to recommend that Canadians limit non-essential travel for the time being. We also continue to work with other levels of government, transportation industry stakeholders, and Indigenous peoples to ensure that Canadians and our transportation system remain safe and secure. Thank you.
Merci, Marc.
Thank you, Marc.
Oui. Tanse, ulukut, good morning, bonjour. I would like to start by sharing some encouraging news. As of today, we can report that 176 individuals of 214 in First Nations communities on reserve have now recovered from COVID-19. As well, the 16 individuals that had tested positive for the virus in Nunavik have fully recovered. I would like to thank the community leaders, frontline nurses and staff who have made all the measures and made sure that we've taken appropriate measures to protect communities and care for the most vulnerable. Dans les dernières semaines, le nombre de cas confirmés dans les
Over the last weeks, the number of new cases confirmed in First Nations communities on reserve and in Inuit communities has maintained a downward trend. May 28th, we saw 212 confirmed cases in First Nations communities on reserve, and no new case has been announced in Nunavik in northern Quebec. This is good news. Flattening the curve suggests that many communities are succeeding in their efforts to reduce the propagation of COVID-19. This is the result of a certain number of things, including the distancing of certain communities, but also aggressive measures implemented by political leaders and medical staff in communities. They were able to leverage their past experience as well as what has and has not worked internationally. I would like to thank them for their leadership. Every single one of them has been proactive in their approach to facing this virus. They're ensuring that information is circulating in their communities. We can see that there's a great sense of responsibility and willingness to work closely with health sector professionals. Their actions have saved lives, and we will continue to support them as long as the pandemic continues.
While this is all good news, we must remain vigilant. The threat of a second wave is very real. When the pandemic broke out, we didn't wait to act. Knowing that Indigenous communities across Canada needed support to prevent and stop the spread of the virus, Canada acted fast. Today, Canada is announcing $650 million in additional funding to support Indigenous communities to prevent and respond to the COVID-19 pandemic and ensure that we are able to continue to react to the evolving needs of First Nations, Inuit, and Métis communities. Of this, $285 million is in new funding to support the rapid and efficient public health response for Indigenous communities to the current COVID-19 pandemic. This funding has allowed us to respond quickly to health-related needs in communities across Canada. This meant increasing healthcare capacity and PPE stockpile, as well as supporting health needs in communities. The federal government has a responsibility to provide direct health care in some First Nation communities, and these funds enable us to live up to our obligation to provide quality care and support them, especially so in times of crisis. We were able to put in place emergency contracts for more nurses and paramedics in nursing stations and health centers that can provide guidance on the appropriate measures to prevent the spread of the virus and act quickly if a community member is affected. Overall, we are in a position to increase the number of healthcare professionals in nursing centers by up to 40% if needed. In addition, to date, we've sent 860 shipments of personal protective equipment, mainly to First Nations communities in Canada, but also to assist Inuit and some urban Indigenous communities. This is in addition to provinces and territories, as well as supplies from First Nations Health Authority in British Columbia. This funding will also support community-led initiatives to respond to the evolving situation, additional cleaning supplies and medical equipment, the adaptation of existing spaces to make them more appropriate for testing and treating the infection, and temporary structures that can be rapidly deployed where needed, providing additional space for isolation or accommodation where needed. I know everyone is concerned about the possibility of a second wave, and we are acting. This funding makes available additional support to communities on a needs basis for community-driven responses to First Nations, Inuit, and Métis communities in the event of an outbreak of COVID-19 or a second wave. A recent example is the $2.3 million of support we provided to the Northwest Saskatchewan Pandemic Response Plan, a collective effort between First Nations, Métis, municipal, provincial, and federal partners to coordinate the response to the growing numbers of COVID-19 in northwestern Saskatchewan in the La Loche area. We are ready to support Indigenous communities when they will need it, according to their needs. Supporting and providing health services to Indigenous peoples is an area of shared jurisdiction. We knew going into this pandemic that we needed to deploy money and resources, physical or otherwise, into communities. Knowing that more than half of the Indigenous population lives in urban settings, and unfortunately some Indigenous communities and service providers have fallen through the cracks, it is not something we're proud of, though we've most definitely made note and acted. Statistics Canada is warning that Indigenous peoples living in urban areas could suffer greater socio-economic impacts during the pandemic due to the higher rates of poverty. For them, staying at home can often mean a loss of income and an inability to meet basic needs such as rent, transportation, and food. It can also have a greater impact on children's education, particularly if they don't have access to a computer or internet. We are supporting some of those communities and organizations working with Indigenous peoples living in urban areas with $90 million of funding. I will add, if we don't work together, federally, provincially, with municipalities, to solve those issues and support the most vulnerable, the situation will remain. We need to be better, and together, we need to make sure that no one is left behind. No one should have to choose between clothing their children or electricity for the next week. No one should be faced with the choice between a roof above their heads or food for their family. But too often this is the case. The On-Reserve Income Assistance Program helps First Nations individuals and families during difficult times so they can land back on their feet and provide for their family. It's a shared Canadian value to help our neighbors during hardships, and COVID-19 doesn't change that fact. As we have stated many times before, Indigenous peoples face unprecedented challenges during the COVID-19 pandemic. We know that the likelihood and severity of an outbreak is greater due to the long-standing health and social disparities in these communities. In collaboration with Indigenous partners, We have to address their urgent needs and help them mitigate the short and long-term impacts of COVID-19. To support the most vulnerable individuals and families on reserve and to weather the impacts of the pandemic, we are announcing a $270 million increase to the Income Assistance Program for First Nations on reserve. As part of this funding, $139 million is in direct response to the COVID-19 pandemic, while the remainder is to sustain base funding so that those who have come to rely on this program have the continuity they need during this difficult time. This funding will enable local First Nations leadership to work with their communities to provide direct support to individuals and families to cover essential needs such as food, clothing, rent, and utilities. Our collective goal is to make sure that individuals and families can go through this pandemic with the most support that they can get, that they can face this new reality with as little stress and anxiety as possible when it comes to their income, and that they can, first and foremost, stay safe and healthy. We've urged Canadians to stay at home during the COVID-19 pandemic. However, we know that home is not a safe place for people who experience domestic or intimate partner violence. We are already investing $50 million to support shelter and sexual assault centers for women and children fleeing violence to help with their capacity to manage or prevent an outbreak in their facilities. Of that $50 million, $26 million has been allocated to the Women's Shelters of Canada to distribute over 400 women's shelters across the country, and $10 million has been allocated to 46 women's shelters on reserve and in the Yukon to support Indigenous women and children fleeing violence. Today, we are announcing an additional $44.8 million over 5 years to build 10 shelters in First Nations communities on reserve across the country, and 2 in the territories to help protect Indigenous women and children fleeing domestic violence. In addition to this support for Indigenous women and girls experiencing and fleeing violence, we will also provide $1 million a year ongoing to support engagement with Métis leaders and service providers on shelter provision and community-led violence prevention for projects for Métis women, girls, LGBTQ, and Two-Spirit people. The government will also provide $40 million to support operational costs for these new shelters over the first 5 years, and then $10.2 million annually ongoing. Alors que la saison estivale commence en force, j'aimerais...
As the summer season is nearly in full force, I'd like to reiterate the messages of caution from our public health agencies. I understand that it's difficult to remain inside during nice days, and it can also be difficult to maintain the precautionary measures. I know that my parents are looking forward to hugging their grandchildren. But as the medical experts with me today keep repeating, we have to continue to be careful. The danger is not behind us. The most vulnerable persons are still at risk of contracting the illness. I know that the next time my children see their grandparents, we will take every measure necessary to ensure their health and safety. Let's continue to work together. Let's follow the advice of our experts, and together we will take care of each other and our health.
Merci, Cho. Thank you. Merci.
Merci. Thank you, Minister. We'll now take questions from the phone. One question, one follow-up. Nous allons maintenant prendre les questions au téléphone.
We'll now take questions on the phone. One question, one follow-up.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. There will be a brief pause while the participant registers for questions. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Thank you for your patience. Merci de patienter. La première question, the first question is from Mia Robson from the Canadian Press. Please go ahead. Your line is open. Votre ligne est ouverte.
Yes, good morning. Minister Garneau, this one is for you. On March 11th, Iran said at a meeting in Montreal that it would hand over the black boxes from the plane crash in January. And as far as we are aware, that still has not happened. I'm just wondering if you can comment and give us any update on the status of that.
Yes, I can, Mia. The boxes are still in Iran, and we continue to exert pressure. Iran, you're right, made a promise that they would transfer the boxes to the Ukraine. That did not happen. It coincided, they said it would be within 2 weeks. That coincided with the serious onset of COVID-19 in Iran, and they explained that they were not in a position to address that matter at that time. However, we continue now to exert pressure on Iran to transfer those boxes in accordance with their obligations under Annex 13 of the Chicago Convention, and we will continue to apply that pressure.
Do you have a follow-up?
I do. This one is for Minister Miller. Earlier this week, Crown Indigenous Relations Minister Carolyn Bennett confirmed that the National Action Plan to respond to the National Inquiry on Murdered and Missing Indigenous Women and Girls was not coming in June. Can you explain exactly how it was that this was delayed? I understand COVID-19 played a role, but COVID-19 has exacerbated the situation for many of these women and girls, and I get there's a lot of people wondering why this wasn't made more of a priority within the pandemic.
Well, thank you for the question, Mia. And I think that the answer is that the report is not a static document. It is a series of recommendations and actions. And from the get-go, our government has moved quite quickly to put into place and to address a number of the issues. Now, the action plan was promised for the beginning of June, and for the reasons you stated, we have not been able to provide it, but it was not an end in and of itself. It takes work with provincial partners, territorial partners, Indigenous leaders, a number of the organizations that the government has funded in order to help work with us to draw up the report, and the current state of preparing to issue that report is not such that we would issue it at this time. Now, obviously, COVID has thrown a wrench in a lot of our programming and affected the government's ability to mandate to do a number of things that we had promised to Canadians. But we're in a situation of a worldwide pandemic where we are acting in real time to address something that, unless you're in your 70s, 80s, or 80s or 90s, you haven't seen before in your lifetime. And that reaction has put stress on other important aspects. But in this particular respect, I think it's strengthened our resolve. There was an interim action plan that was issued by Minister Bennett, which dealt with Indigenous liaison units, funding for mental health supports. These are all important actions that were responsive to the report. Now, they are not an action plan in and of themselves, but they are responsive to the report. And I would note the legislative agenda that we put forward under the last mandate, whether it's C91, C92, or some of the reforms that we made to the criminal code, take action with respect to what was recommended on issuance of the report a year ago. Yet a lot of work remains to be done. The increase in funding that we announced today for building of shelters that was announced a week ago to support Indigenous women and women fleeing violence are very, very important steps that are in part responsive to what we've been asked to do pursuant to that report. It doesn't change our resolve, and we continue to push that agenda quite aggressively and to act in the difficult context of COVID-19, obviously.
Thank you. Next question.
Thank you. The next question is from Dylan Robertson, Winnipeg Free Press. Please go ahead. Your line is open. Votre ligne est ouverte.
Hi, Minister Garneau. I wanted to ask you about the death of a conductor on the Hudson Bay Railway in Ponton, Manitoba. This was in the 2018 derailment. A month ago, I asked your office for an interview about the Transportation Safety Board report. The TSB found that Transport Canada had never reviewed the safety plan when the Churchill Railway was transferred to local ownership. The TSB found that if your department had done proactive monitoring, the gaps in the plan that contributed to a death could have been fixed. I want to know if anyone at Transport Canada has faced any consequences in this death and what you're doing to prevent this from happening again.
Well, thank you very much for your question, Dylan. Obviously, that was a tragic accident with loss of life, and the TSB investigated, as you point out. We are in the process of examining the TSB report, and we will obviously be focusing on any recommendations that the TSB is making to us. We have a certain amount of time in which to respond, and we are currently assessing the TSB's report to know if there are specific measures that need to be taken by Transport Canada.
And a question for Minister Miller. You likely saw that the Manitoba Premier is upset about a First Nations band planning a powwow. They're expecting more than double the crowd allowed under the provincial public health rules. Premier Pallister says that this is two-tiered health, and I'm wondering if your office has changed its policy or done any outreach after this came up in Saskatchewan last month. And also, is Ottawa going to compensate provinces if there's a bump in healthcare expenses as a result of these gatherings?
Good morning, Dylan. Since I got into this job 5 months ago, Indigenous leadership have told me that they live in Canada in a two-tier health system and are the victims of it. Those are the cards, I think, that Indigenous communities would say they were dealt going into this pandemic and create that vulnerability that is that is exacerbated by COVID-19 and the real risk of spread into communities. Knowing that, it has made the job more complicated of engaging, ensuring that leadership, both political and medical, are engaged at the get-go by First Nations Health Authority to ensure not only that they have the financial resources, but the physical resources, whether it's stock nursing stations, nurses, paramedics, whether the hospitals are properly staffed, making sure that the latest protocols are in place to ensure that communities can respond and have actually really well responded. And Manitoba is one such case. Leadership has been exemplary. If you believe in self-determination of Indigenous peoples, you have to respect choices even when you don't agree with them. And that makes the job, when it comes to a pandemic, when it comes to having a health response to a health problem, it makes it, frankly, more complicated. But it really is the only way to go. And for us at First Nations Health Authority, and I can only speak for the work that our team has been doing, it means direct contact with community leadership, making sure that proper social distancing, physical distancing, testing, tracing, tracking is done in a more proactive fashion than perhaps we've done in the past. We can't sit here in Ottawa and dictate terms to First Nations. That's been tried before. But it doesn't mean we disengage completely. In fact, it means we engage more intensely. And that means that the job of people like Tom to my right is made much more complicated, but also much more rewarding, because the results, we know when leadership and decisions are made by communities, Indigenous communities, and I speak for all of Canada, the medical results, and it's proven, are better. And that's the direction that we're going in. Will mistakes be made? Most certainly. But that means more intense negotiation. It means more intense engagement and sometimes disagreement. But that's who we are as Canadians, and that's the relationship that we said we will have with Indigenous peoples in good times and bad.
Thank you. Next question.
Thank you. Merci. The next question is from Jorge Berrara, CBC. Please go ahead. Your line is open. Votre ligne est ouverte.
Thank you. This question is for Minister Miller. Minister, the First Nations in Saskatchewan have lined up their own supply of PPEs, but they say that your department is resisting approving their proposals for this. I'm just wondering if this announcement today means that First Nations that have secured their own supplies of PPEs will be able to move forward.
Thank you, Jorge. Our provision of PPE has always been for medical frontline health workers, and the 900 or so shipments that we have sent into First Nations community reflect that. We aspire for a turnaround time of about 24 hours. As you know, the worldwide supply of PPE, depending on the nature, is quite scarce, and so it's a real question of sourcing, availability, and needs. We obviously support First Nations communities when they want to get their own source, and it's a question of financing and support. But that's an ongoing dialogue that we're having internally. I would note, and I'll have to check back with you today and invite you, in fact, to our technical briefing, because I'll have the opportunity to check in with my team. But I believe we were supporting and I don't know if Tom knows more about that, but we were supporting FSIN in some elements of its procurement process. It's something we're prepared to do. And the question will become even more important, Jorge, as provinces open up and PPE starts being used for other uses other than medical frontline work, and issues of scarcity obviously will arise, but obviously independent procurement, and it's something that we will work with communities on a case-by-case basis. But I'll pass it over to Tom because he may have more information specifically.
Yeah, thank you very much, Minister. We indeed supporting First Nations communities, to acquire PPEs for non-health services related functions. So this is in addition, to our direct support for PPEs for the provision of health services, whether it's by healthcare workers or by others who need to actually provide health services, including family members who have to provide health care to family members as well. Thank you.
Do you have a follow-up, Jorge?
Yes. Just on the funding announcement today, you said needs-based. So this is going to be is this a proposal-based mechanism to access the funds for the 285 million for public health responses?
The funding today that deals with the public health response, so the portion of my announcement today, Jorge, that is $285 million has been a continuous financing proposal to prepare for surge capacity into communities on a needs basis should there be spreads, preparing and implementing pandemic plans. So, whether it's medical units for pre-screening and triage or multi-purpose accommodation units, supporting and retooling existing spaces according to communities' pandemic plans. And I believe we've done so in about 70 communities. So it's really an ongoing rolling fund that has been addressing needs. We didn't wait to act. We have acted with the financial resources within Indigenous Services Canada, but this is an amount that reflects an additional appropriation of monies to be able to respond in a more targeted way should a pandemic, or rather should COVID-19 spread in communities. One of the examples that we funded quite quickly was the spread in La Loche, and the response to date actually has been exemplary by the community in stamping it out. And other communities should that arise. And so communities can approach us and approach our regional directors general to with their proposals according to their pandemic plan, and we should be in a position to respond.
Thank you. We'll now take questions from the room. Again, one question, one follow-up. Encore une fois, une question.
Once again, one question, one follow-up.
Ian Wood, CTV News. Minister Garneau, today we saw some GDP projections that are the worst for first quarter since the 2008-2009 financial crisis. With those in mind, have we made a decision yet on whether or not we'll be bailing out the national airlines, whether it be Air Canada, WestJet, Transat, should they need and ask? I know they've been pushing for that.
Well, thank you for the question. And as you know, we've already announced certain measures. One of them is the wage subsidy program, and some airlines have availed themselves of it. And there are also other measures for small and medium-sized airlines, the BCAP program, which is the business credit facility program, as well as for large airlines, the LEAF program, the Large Enterprise Emergency Financing Facility. Both of those last two programs are to allow access to credit. We are watching the situation and monitoring it very carefully. There's no question the airline industry, and I include airports and NAVCAN, which is our air traffic controller, have been disproportionately hit by this pandemic. As you know, the airlines have lost more than 90% of their revenue. In some cases, their future is in jeopardy. So we are monitoring the situation very carefully because as Minister of Transport, I want to make sure that as this pandemic recedes, so we still have an airline industry in our country. Canada is the second largest country on earth, and the airlines in this country are just as important, for example, as, well, today we take for granted that we have to be connected together through broadband internet, and it's something that's there all the time. Well, it's just as important that in this very large country with very remote areas that we maintain an airline industry when we come out of this pandemic. So we are watching the situation very, very carefully.
And so just to be clear, Minister Garneau, is there a plan right now on the table to make to provide a bailout if the airline requests that?
As I say, we have just recently announced the LEAF program, and we're waiting to see how the industry avails itself of available government programs, including, as I mentioned, the wage subsidy. We'll give it a little bit of time and monitor it very closely. And we're also monitoring very closely as airline activity begins to resume, albeit slowly at the moment, but there is the beginning of it. So we're watching it on a daily basis at this point.
And if I may, Minister Miller and Dr. Wong, just a question on Indigenous funding today. There's been a lot of announcements about funding for Indigenous communities within the COVID-19 pandemic, providing PPE and support. I'm just wondering about all the previously existing issues that were going on in these communities, whether they be things like boil water advisories or housing concerns. I think, Dr. Wong, you could perhaps explain, you need some basic necessities in life to be healthy, to be able to withstand a virus. So is this money, all these announcements that are being made with regard to COVID-19 and Indigenous communities, are they going to be funding anything to fix the previously existing conditions?
I think you raise an important point as to a number of the initiatives that the government had for addressing the pre-existing conditions that led Indigenous communities to be more vulnerable at the outset, whether that's housing, and we did invest historic housing amounts over the course of the last 5 years. Obviously, that wasn't sufficient. But if your question is, does our mandate change because we've invested with COVID monies? The answer is no. In fact, the reflection we need to have coming out of this pandemic is how do we build back better? How do we face the potential, another potential pandemic, going into it with the same cards that were dealt on this pandemic to Indigenous communities? And I think it would be entirely unfair, unjust to do so again. Now, closing the housing gap by 2030 is a clear mandate of the government, addressing the need for schools and hospitals. In fact, we inaugurated the expansion of a hospital in Listugush, a school, 3 days ago. So the work does go on. It is made much more complex, obviously, and we're working hard on boiled water advisories. There are obviously challenges with respect to getting infrastructure in the cases of complete new rebuilds into certain communities, depending on remoteness and depending on actually the health protocols that prevail under those conditions. But as we think forward and as we look at what the new normal is, and working aggressively to eliminate all those social, or at least equal the social determinants to non-Indigenous peoples, these are things we're going to have to do, think about in this new normal until such time as we find a vaccine and effectively deploy it. So the mandate, I think what it's done for a lot of us is focused the issue again on some of the inequities that do exist in Canada, in one of the most developed countries in the world. Tom, do you want to add anything?
Indeed. Thank you very much, for your question. The social determinants of health, housing, water, food security, all of those basics, fundamentals of life, those are critical, for First Nations, Métis, and Innu community in order to address this virus, not just this COVID virus, but also all other issues, whether we talk about mental health, suicide, TB, etc. The future, is here. The future, is for us to build together with all of these resources. And without more resources, without more housing, without better water, we won't be able to solve the issues. Thanks.
Thank you very much. Operator, we'll continue with questions from the phone. Nous allons continuer avec les questions au téléphone.
Message repeated in French.
Merci. La prochaine question, the next question is from Christy Sersek, the Globe and Mail. Please go ahead. Your line is open. Votre ligne est ouverte.
Hello, good morning. My question is for Minister Miller. I know you've spoken previously about gaps in data that exist in First Nations communities in particular. I'm wondering, even in urban centers, there are questions about, the extent of testing and whether or not we actually know how far-reaching COVID-19 is. And of course, the availability of those tests is far greater in an urban center like Ottawa compared to a remote First Nation. So I'm wondering how, as economic activity ramps up in various jurisdictions at the provincial level, can we really be sure that we know the extent of the crisis in First Nations communities?
And this is a critical question, Kirsty, and you talked about a number of issues. One on testing, and testing protocols to date have revolved around testing symptomatic individuals and people that have been in very, very close proximity to such individuals. And more often than not, that has been in urban centers where there has been spread, or in hot spots or hot zones that have been able to be identified. And those protocols, for example, in northern Saskatchewan, in La Loche, have been deployed quite aggressively in what is probably percentage-wise the most important spread of COVID in the country. But that quick reaction time has enabled people to address it and move towards bending the curve that we all aspire to. These are challenges that communities face writ large, but we can't identify that and move towards better public policy generally, and to what you alluded to directly, which is how do we move into what is the new normal, and that new normal can only be guided by probative evidence from scientific testing, from serology. The public community task force that has been put together by government has Carrie Barassa, which is an Indigenous leader, well known and respected in the field, to give some Indigenous input on that and to identify the solutions forward to addressing concerns that are unique to Indigenous communities. Now, the gathering of data, as we've said before, of what Indigenous Services Canada focuses mainly on information that we get from Inuit Nunangat and First Nations on reserve. We've been able to tease out information based on data that's been provided to us from the provinces and territories, even though that data itself at the gathering point, at the collection point, is inconsistent. We've been able to tease out trends, and so far, as we've seen on reserve, the reaction has been very, very positive, but it's not something we take for granted. In the urban setting, it's a little less clear because of the mixed jurisdictions, because of challenges identifying whether someone is First Nations, Inuit, Métis at point of sight. But we have some encouraging researchers working out of the University of Toronto that we have enabled with funding, and we're working with provinces. We've identified the problem, and the solution isn't complete yet, but it's something we've identified as a government, and we've seen it in other areas with respect to ethno-cultural disaggregation, which is very important to be able to identify trends and react in that smart way in the short term, and in the long term being able to allocate resources from a public health policy perspective in a smart way instead of doing guesswork. But that all involves real-time coordination with provinces, territories, public health authorities, and that isn't perfect right now, but we're getting better at it.
Do you have a follow-up, Christy?
I'm just wondering to what extent you've heard from community members about some increased anxiety about that, increased activity at the provincial level, and the prospect of COVID-19, having a greater reach within communities that have done so much work to set restrictions and try and keep the virus out.
Well, we hear I hear it on many times during the day as I engage with Indigenous leadership, whether it's discussion around security. We all saw in the media the issues in and around Okanagan, the issues in Kiosk. That is something that I don't think we've seen the end of. Clearly, communities have been very, very proactive in protecting their people. It's something that needs to be lifted up. But as provinces, as we start to move towards this new normal, it's very possible that communities take a decision that is not the same as ours. And as I mentioned earlier, with respect to decisions in around ceremonies and cultural practices, it's something that involves more intense engagement as to how we support communities in their decision making. And we can't expect everything to be identical all across 600 plus First Nations in Canada. But we do have to engage and make sure that everyone has a proper health protocol so the decisions are being made with the latest and greatest information about something that we haven't really fully understood yet in COVID-19. So yes, I do hear that. I hear it often. It's an increasing voice in and around more funding for security, in and around more supports for income, and from communities that are very, very proud of their own source revenue, but have seen that stemmed as the result of closing their access to their communities. So it's an increasing voice, but it's something we'll deal with together.
Thank you. Opérateur, prochaine question.
Thank you. Merci. La prochaine question, the next question is from Raymond Filion, TVA. Please go ahead.
TVA.
Votre ligne est ouverte.
Merci. Bon matin. Une question pour
Thank you. Good morning. A question for Mr. Garneau. Canceling cruise season will cost very dearly in the tourism sector. What is the federal government planning to do to help the tourism sector?
Ma collègue, merci pour la question, Raymond.
Thank you for the question, Raymond. My colleague, Ms. Joly, is responsible for tourism. I agree with you. There will be a serious impact on the tourism industry, especially for cruise ships. This is something that is important for some provinces in our country. Unfortunately, because we have decided to minimize risk, there will be economic impacts. I would ask you to talk to my colleague, Ms. Joly, about the impact on tourism. Follow-up question. Could you tell us if there are going to be specific programs? And I'd like to hear you about plane tickets for canceled trips. This week, we're decoding from what you have said that your decision has been made. Ottawa will not order airlines to reimburse clients. Is that the case? Answer. On that matter, we're continuing to monitor the situation. As I've mentioned several times, I have a great deal of sympathy for those who are frustrated and would have preferred to get a reimbursement rather than travel credits. However, if airlines had to immediately reimburse all canceled plane tickets, the economic impact would be devastating, nothing less.
Merci, opérateur. Dernière
L'impact sur comme vous savez, ils ont perdu.
The interpreter notes that there seems to be a disruption in the video and audio feed.
Ils ont accès. Mais pour moi, c'est important.
Service will resume as soon as possible.
La pandémie va passer, qu'il nous reste encore des lignes aériennes.
When the pandemic is over, we hope that we will have airlines in our country that can still provide service, which is important for tourism. This is a difficult situation, and we're monitoring it from day to day.
Minister, can you repeat in English, please?
Yes, I can. As on the question of vouchers versus refunds, I have said many times that I have enormous sympathy for those who would have preferred to have a cash refund in these difficult circumstances. It's far from being an ideal situation. At the same time, if airlines had to immediately reimburse all canceled tickets, it would have a devastating effect on the air sector, which has been reeling since the COVID-19 pandemic started. They've lost more than 90% of their revenues. And at the moment, the option, as mentioned by the Canadian Transportation Agency, is that they can obviously have access to vouchers, which are good for 2 years. And Air Canada has now announced that their vouchers will have no expiry dates. We are monitoring the situation from day to day. But as Minister of Transport, I have to say that I also have a responsibility to make sure that when this pandemic is over, we still have an airline industry. It's so essential for this country. This is the second largest country on earth with vast distances and remote areas. And we expect and need an airline industry in this country. So trying to maintain that fine balance is what is important here. We're monitoring the situation on a daily basis.
Thank you, Minister. Opérateur, dernière question.
Operator, last question.
Merci. La prochaine question est de Hélène Buzetti, Le Devoir. Please go ahead.
The next question is from Le Devoir. Please go ahead. The line is open. Question. Mr. Garneau, I would like to continue along the same lines. You didn't exactly answer my colleague from TVA. Is your decision final? You say that we will continue to monitor the situation. What could happen in the next few days or weeks that would make you change your mind and would lead you to say, no, we have to issue refunds? Answer. We implemented measures for the airline sector. As you know, there are wage subsidies available, and some airlines are using them. There's also programs to access credit for large businesses and small and medium-sized ones. When it comes to access to credit, these programs have been set up recently. We will offer some time to see if airlines are availing themselves of them. If flights resume, the process will be slow. We will have to be very careful, but in the days to come, we will see if the situation stabilizes. Let's hope that it does and that it even improves. As I mentioned, we're monitoring the situation daily in order to see if the state of our airline sector is worsening or if the situation is beginning to improve.
And my follow-up question would be actually for Dr. Wong. I don't know if you've seen, but Jason Kenney earlier this week said that the confinement should not be prolonged or contemplate if a second wave happens because it imposed too harsh restrictions on general population when it's only the very old people who die. He called on public health officials from now on to propose protective measures that are as discreet as possible. That's his words. So I wanted to know what you think about that.
Your question. One of the things that we have to be very cognizant of is what has been shown to work. And we have seen in Canada, take the example of, First Nations communities. Because of First Nations communities and their leadership, the resolve and the decisive action of lockdown, shutting the borders, physical distancing, avoiding crowds, all of those things. We are seeing that on First Nations on reserve, there's been very, very, very little of the spread of the virus in general in First Nations on reserve. And Dr. Tam has talked about, how for the rest of the country, she's also seeing those very effective measures. So isolation is one of those measures after rapid detection and rapid tracking of cases. And all of those things are part of why we are able to contain the virus and flatten the curve and plank the curve. And it is so important to continue to do so. Thank you.
Merci beaucoup. Ceci met fin à la conférence.
Thank you very much. This concludes the press conference.
Have a good day.
And you are watching right now another press conference coming out of Ottawa, that one delivered by Dr. Tom Wong, who's the Chief Public Health Officer for Indigenous Services in this country. He was sitting alongside Marc Miller, the Minister of Indigenous Services, and Marc Garneau, the Transport Minister, was coming in from Montreal. A couple of significant announcements I want to go over. I'm Vashi Kapelos. I'm coming to you right now from Ottawa as well. We are standing by for the Prime Minister's daily briefing, which is scheduled for about 20 minutes from now, a bit earlier than normal, but we will bring that to you live the second it happens. I do want to go over some of what we heard in that press conference because the Prime Minister will also touch on it. Two significant announcements. First of all, from Marc Garneau, the Transport Minister, he is extending the ban on cruise ships in Canadian waters from the end of July to the end of October. That will obviously have a big impact on the tourism sector in this country.